have a look at this clinical question. Okay, that's your time. If you'd like to select an answer, please. While you're doing that, just a reminder of the scenario. So someone is 42 and they've got anxiety, confusion, and vivid nightmares. So she remembers exactly what happened. It's distressing even through the day because of these nightmares. And what we see is that a couple of days ago, we were worried about pyelonephritis and they were prescribed Cipro. No past psychiatric history. Examination, they're well, but there's agitation. So no other abnormal findings beyond the agitation. So what's the most suitable step in management? This one, nearly everyone's got right. So well done. So D is the correct answer. Stop the Cipro. Think about a different antibiotic, because what you don't want to do is just stop the Cipro and you're not dealing with the pyelonephritis. That could make them seriously unwell. All right. Why is that? Because ciprofloxacin is of the class of fluoroquinolones, and so psychiatric reactions have been seen with this whole class. So think that confusion, disorientation, anxiety, depression, psychosis, suicidal thoughts, even attempts at death by suicide. It can affect any of the fluoroquinolones, but these are the ones specifically mentioned in the MHRA alert. Okay, and of those, if you think, quite commonly we prescribe ciprofloxacin in GP or levofloxacin. Okay. And we should advise patients that if they get any new mood-related symptoms, because you can get these things in patients without any previous psychiatric history, that they should get medical advice. And if they get suicidal thoughts, they should just stop and get urgent medical advice. And we already mentioned that actually it's already been known with quinolones that it can also cause myasthenia gravis. But the other big one is tendonitis and tendon rupture, which condition where Cipro used to be the first-line drug, is it no longer recommended as first line? Anyone know? Chronic prostatitis. Yeah, absolutely. Because of an MHRA alert, because in chronic prostatitis, they may be on medication for longer term, for a couple of months. It's not recommended because of this risk of tendon rupture. Whereas in acute prostatitis, because it's a shorter period, it can still be used. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.